Good afternoon. We're here today for a very interesting conversation and a very interesting person with the Vance Center. And not only is he a interesting person, but he's also a board member here at the Vance Center. And basically, we're going to go through some things today pertaining to some health issues and what they are and how to proceed with a primary care physician and how to put those things together. And we're very, very fortunate to have here today Dr. Isaiah Abney. And Mr. Abney, Dr. Abney, I'd like to refer to it.
You got the middle initial, J.
Oh, Jay. What does that stand for?
Julian.
Julian.
Yes.
Okay, now I've known you now for over a year or more, and I didn't know that. I did not know your middle name, but now I know it now. And were you named after anybody by any chance?
My father.
Is that right?
Yes, yes.
And what was your father's name?
Isaiah Julian Abney.
Okay, so you're like a junior.
Right.
Yeah.
Yes.
I just happen to be a junior also, Oscar P. Vance Jr. A lot of people ask me about my middle name also. It's Palmer, Palmer.
Palmer.
Yes, and there's an interesting story around that, but we'll get into that another day. But in terms of what you do and what you did as a physician, now you were a physician for like 44 years, am I correct?
Yes, I completed my training, and that is medical school itself, in 1980. I graduated and then did postgraduate training at the Metropolitan Hospital here in Philadelphia, which is no longer here. It's merged with one of the institutions or groups that's present. And I'm boarded in family medicine, and I practice approximately 43 to 45 years.
Well, that's a long time. And I'll bet you have many, many stories that you could tell us about, but I won't get into all those stories in terms of all those things that you did over those 44-year period of time. But in terms of what made you become a doctor to begin with?
To be frankly candid with you, another doctor in the neighborhood. He made quite an impression upon me. And I really wanted to help people. I thought that I could help people make a difference in individuals' lives and do something that I would enjoy and benefit from. I could go on, but in its essence, that's it. To really be helpful to people and what I perceived and saw as a real productive and beneficial way to make a living and to spend a life.
Well, I can imagine that was a very challenging period.
It was noble calling, in quotes.
Okay. And during that period of time, I'm sure you had many, many interesting cases, and which brought us here today from this Vance Center from the standpoint of, there are many people that go along in life, and including myself, in terms of picking out a primary physician. And I think that's what our discussion is here today in terms of how do you pick a primary care physician?
Well, good question, but I'll start with where medicine is today, and I guess elaborate on the process.
Right.
What years ago, you didn't choose it; he was in your neighborhood.
Right.
Doc was down the corner, like Dr. Fliegelman, the guy that I was impressed with.
Right.
As we see things today, medicine has changed considerably. It's no longer a specific individual in a neighborhood or groups or a single individual and 3 or 4 docs in a neighborhood. It's become a medical institution now. Groups of doctors providing primary care to a certain geographical area.
I'm familiar with what you're talking about. I know I served on the with the Jefferson Hospital. It started out with Abington Memorial Hospital, and then grew from there to 17 hospitals that Jefferson has. And being on that trustee board for since 1979, gave me a good insight in terms of what you're talking about. In terms of when a patient or someone who is venturing into an institution the size of Jefferson, for instance, they have something that calls personal care or first care. What is the proper name of that?
That would be primary care, your first point of contact,
Okay.
or your primary provider. That primary provider could be your physician, it could be a nurse practitioner, it could be a physician's assistant, uh, or in some instances, the first person you might meet might be the specialist that you were referred to see for specialty needs. But generally speaking, you will see your primary care provider who is uh, categorized in the manner that I just did: primary care physician, nurse practitioner, physician's assistant.
So then that very first person that you may meet when you go into that large institution, or whether it's a doctor's office, which
Mhm.
there aren't too many of those in existence anymore. They usually work for some type of a larger corporation.
Organization or hospital group.
Okay.
That's primarily the structure today. The major groups in Philadelphia: Jefferson, Penn, Temple, PCOM, Drexel. Those are the five, yeah.
Okay. So what do I look for as a patient who walks into a large institution like that for the very first time, looking for a primary care physician that's going to be compatible with my family and so forth?
Often the first place to start is with your health insurance provider, based on your medical needs, and if they're for a specific initial visit, they can direct you to their primary group that would be suitable for your specific needs,
Okay.
i.e., pediatric primary group versus
Right.
a adult medicine primary group, or a geriatric group, or an OBGYN group.
Okay.
So your healthcare provider, insurance, provides you with a list, often, of people you can select. And mind you, all the people that are participating in their group are well credentialed. So
Now, most of those people, like you mentioned, like it could be your a nurse there at that
mhm.
institution, or the primary care person themselves, or it could even be an administrator or whatever that you come in contact. What is something that I should ask for as a person who just walks into that place or is directed into that place? What are the next steps, so to speak?
Well, if you are scheduling an appointment, you don't have a medical urgency or an acute problem. So let's give the example. I'm here for a routine physical examination. That's what you would schedule your appointment for. I'm a 45-year-old male. I don't have any pre existing problems. I just need to make sure that at this point in my life, I'm establishing a relationship with a medical provider in the event I need someone in the future.
You bring up a very good point there. With most people and in most communities, most people don't have a physician assigned to their family or assigned to them in particular as far as handling those health issues that may come up. That seemed to be a very, very difficult and focused situation with people who are in the community. They don't have a physician.
You mean, usually if you have insurance today, um, you have access to an assigned individual
Okay.
that you will be given for primary care.
Yes.
Uh, in fact, they will make that available to you. So it's not the shopping that you need when you wake up and you have a sore throat or headache.
Okay.
You usually have someone assigned that, based on your selecting that insurance company, um, you've chosen them, and now you contact them and make the appointment.
Okay.
Hopefully that answers.
Okay. Now, in terms of that, most people, including myself, we don't usually go to a doctor until there's something seriously wrong with us, until we're usually when we're on our back or in the bed and feeling very bad or with walking pneumonia and wondering, what should we do now? What's your recommendation for something like, people like that?
If you feel you need to see a doctor urgently, then many offices, many primary care offices have a urgent schedule or walk-in schedule. If you feel you are really very sick, you can go to urgent care centers where you walk in and present your medical history, or a lot of times they present and you can see the nature of the medical need. If you really feel that sick, if you have a laceration, you fall and you've broken a bone, often you may want to visit an emergency room if you truly have a medical emergency.
People who are having that kind of a difficulty of any kind, they should go there.
Yeah. In fact, the need, the changes that have occurred in medicine since the 70s and 80s, it's designed now for people, if they have a viable relationship with their primary care doc, you can call them and they'll say, maybe we can fit you in today. If not, they may recommend go to the urgent care facility that's associated with your group, or go to the nearest emergency room. For example, if you're assigned to a Jefferson physician, you may want to end up at a Jefferson ER.
Okay.
But if you have an emergency, you go to the nearest emergency room to you, or urgent care facility.
Okay, that's very good advice. Because, like I said, most people wait until the ambulance arrives, or they have some kind of a serious situation.
In most cases, your insurance company will tell you, it'll be on your card, if you have an urgency or an emergency, go to such and such facility.
Yeah. Now, everyone has this so-called electronic device called an iPhone or an Android or whatnot. In today's time, there are a lot of apps and things that people can get put on their phone and things of that nature as relating to their health issues. What is your recommendation in that area, if you have any?
Well, that's the state of medicine today. Everything is computerized.
Okay.
If you have a viable program, and all of them function on a portal system, and everything's done on the computer, and with that you can plug into your chart, your healthcare group, your doctor. You can make an appointment with them. You can call them and have telecommunication in some instances. You basically have a way of creating a more thorough note, a way of documenting and storing that information. So today it's imperative, and the way to function is with your phone.
Okay, so in terms of this so-called portal system that you mentioned, there are some people who might not have access to a iPhone, or they might not have the technology to operate their iPhone or whatnot. What's your recommendation for that type of an individual?
If you absolutely don't, I don't know many people but if you have an urgency, or you want to establish an appointment, and you don't have let's say insurance, or you don't have a phone, then that should not deter your seeing or going to. In some instances, if it's an emergency, the nearest emergency room, or contacting who the physician group is in your community.
Right.
But often, most people have access to some way of communicating, because the medical record today is totally computerized.
Now, in terms of senior citizens and the community and whatnot, there are many senior citizens that are afraid to operate the iPhone or Android or whatever. What kind of a recommendation would you make to them in terms of getting in tune with the modern day system, in terms of understanding the portal
Mhm.
and their history and so forth?
Again, your insurance policy provides instructions for you. They will contact you with the uh, communications people that will facilitate and develop an ability for you to function in the electrical medical record. So they will assist you in uh, uh, procuring the necessary items that you need to function.
Right.
If I'm being clear,
Yeah, that's very
yeah, yeah.
clear. Very
Most
clear.
people um, have a way
Hmm.
of interacting with the current electrical medical record that we have today.
Right. And in terms of senior citizens, one of the things I've noticed in terms of many families, including my own, uh, there should be somebody in that family or somebody in the community designated as a person that a senior citizen can go to, as far as being a designated caretaker or
Mhm.
somebody that they can take care of the elderly person or senior citizen that does not have that capability of technology.
Yes, extended family is often number one, a son, daughter, relative. But Medicare and your insurance provider
Mm.
has a way of contacting them if you find that you aren't capable of utilizing the communicative system that's available. They'll even come out and give you some instructions. Um, what I have seen in a geriatric patients, sometimes if you don't require to be in a skilled care
Right.
facility, they will check on you on the phone. They will make certain that you're not lost to follow up. If I'm making any sense with
So,
regard to that.
so your advice as you begin with how a person should respond and so forth. So, the year 2026 and where we are today in the modern time, there's no excuse for anyone, regardless of what their age is or so forth, that they should not have the necessary medical attention and procuring that medical attention in health situations that they need. Uh,
Uh,
okay.
yes.
Uh-huh.
Having been in a hospital recently, well, a couple of years ago,
Sure.
they 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 follow up. They don't just release you without a structure that you can access or a system that you can access for continued care or any regression of the progress that you've made. Someone is always in contact with you. For
Okay.
example, I have follow-ups. They schedule those appointments. They send you a notice maybe 3 weeks or well a month before. You
Okay.
can schedule your appointment. If you miss that, they'll reach out consistently. If they don't get you, they'll call you or reach out to you.
And I think that also in the area of medication too, medications for the elderly and also for the young people too. Uh, Doctors and institutions, they also have a connection with that also in terms of being prepared and how to get their prescriptions and things of that nature.
Absolutely. Again, it's a medically or computer generated prescription. The refills, they go to the pharmacy, all of that's fed into the computer. They let you know when your meds will be available, et
Okay.
cetera. So
Very good.
it's a far more efficient system that we have today. It's proactive.
Yes.
So they won't let you run out of your medicine.
Right.
If you stay abreast of your messages, I have an appointment with a doctor on the
Mm,
16th. I got a note, a message from them last month. Your appointment for the 16th. Did you want to schedule now? And or just answer yes if you want to continue with that appointment, or no, do you want to change the date?
right,
So it's all proactive to prevent someone, uh, as they say, falling through the cracks.
right.
Yeah,
Okay.
it's very efficient. Very.
Yes, and I think that those things that you mentioned here today are excellent in terms of
Mhm.
advising patients and also advising families and the elderly how to follow through with information in terms of how to get a primary care physician during the year of 2026. And in conclusion of all the things, just to recap those things that we discussed here this evening, uh, just give a general overall conclusion in terms of those things that we just discussed in terms of the steps and things that you mentioned here today in terms of evaluating what they should do and how they should do it, and just give us a final conclusion in terms of recommendations as you made today.
With yeah, with the quality of healthcare that we have in the metropolitan area, Philadelphia County, Montgomery County, there, in my observation, is no excuse for anyone to fall through the cracks. We have Medicare, Medicaid, we
Yes.
have commercial insurances. So once you acquire a an insurer that will guarantee payment, they will be proactive in giving you a list of primary care people that you can select from that are close to you. Often, when you've acquired your insurance, they will call you and assign someone to talk to you and make certain you've established a primary care doc and even help you schedule that appointment. Um, what was the other aspect of that?
Well, mainly the steps
Yeah,
that they go through.
establish a primary care physician. Find out what kind of medical problems you have, if any. There are routine things that should be done as you reach certain levels of adulthood. Routine tests for prostate cancer in men, um, routine blood work to see if you have diabetes or any other of the medical maladies, just to see if in fact you're anemic. So they're basic things that should be done and determined on your initial evaluation by your primary care doc. And again, that could be a physician's assistant, a physician, and a
Very good.
nurse practitioner, or even a specialist if that's your initial contact.
Okay. Now, you spent 44 years as a physician. Uh, what advice would you give some of the young people who might be deciding that they may want to go and someday be a physician
Hmm.
like you served for those 44 years? What are some of the things that you would tell a young person who is interested in that?
Well, I'm not a philosopher, but I was told by a wise gentleman. He said, "The future's now." So if you are interested in medicine, you want to prepare for that, and that's today in junior high school, where you get out the scientific curriculum that you must be exposed to
Right.
and are required to go to medicines, required to go to a medical school or become a nurse or even become a physician's assistant, which would allow you to enter medicine as a primary care provider. I would say early on, do as well as you can in school because it's extremely competitive. And one of the reasons it's extremely competitive, you can get a very good job making a better than average salary and a very rewarding life that is reinforcing in your development. But the key thing is do well in the sciences, uh, certainly mathematics. Um, that's it. Be an excellent student, and you have to know how to write and communicate.
Okay.
So the essence of a viable, effective education. Try to have nothing lower than a B, because you're competing with very ambitious individuals,
Okay.
because of the rewards that you can potentially acquire.
Very
Hopefully,
good.
I've given you some perspective.
Yes.
Again,
Yes, Dr. Abney,
the future's now.
Dr. Abney, you were excellent in terms of giving your information, not only for the primary care physician, but you also expounded upon some of the things that the youth need to focus in on, not only in their health, but also their career and in terms of reaching out into the community and being effective as a individual as they grow up.
Well, let me just add this. I recall when I thought I wanted to be a doctor, I worked a summer in the hospital,
Okay.
worked as an orderly, or work with a doctor, or find someone that could give you a realistic perspective of what it's like. And that's not difficult today. Many of the educational programs will see to it that maybe what you think is a excellent choice may not be the right choice for you.
Right.
If you're afraid of blood, you've got a problem.
Okay.
So yeah, I would suggest become proactive and see it before you commit yourself to that.
Okay. Well, Dr. Abney, we want to thank you very much for your information, and I want to thank you for being here today. And not only that, but for all of your work that you've been doing with the Vance Center. I want to thank you for those things and the information that you passed on to the community in terms of being prepared and ready and for good health. And that's one of the things that we want to expound upon as far as the Vance Center is concerned. Get involved with your community, get involved with the youth, and get involved with people like Dr. Abney, who are giving of his time to discuss those things with you today. And we're going to invite him back here again in a series of different things and questions that we have pertaining to health in the community. Thank you very much.
Well, thank you. Thank you, sir. It's been my pleasure.
Thank you.
Very nice.